more women entering the workforce. And finally, what we expect from the state and what we expect from our lives is changing. In some countries, people are seeing more and more the state should not be getting engaged in some areas like occupational workplace protection. And we may be expected to live longer and have more leisure. And this changes how we have to look at our world of work. So all these factors are very dynamic and flexible, and we have to structure worker protection in this context. So I guess we should say, what's the point, what's the purpose of safety and health law in the European Union? And the first is clearly to protect workers, and that means from immediate and also from long-term harm, from all hazards and risks, workplace hazards and risks. But also there is other factors involved. Europe wants a level playing field for its businesses and to achieve a common market. And to do this, we have to have common standards of protection. We want efficient businesses. Accidents and ill health give direct and indirect costs to businesses. And failing to protect workers leads to massive demands on state social insurance and health systems. And we are hearing very clearly that we cannot afford to continue the losses we are having. It's putting too much on our pensions, on our health protection systems. I have come here from Estonia. I arrived yesterday, where there was a meeting of experts, and in Finland they reported the cost of lost labour input, that's the cost of losses from accidents, ill health, people being pensioned off, absenteeism, is €2 billion a month, just for Finland. We can't afford that. Can Cyprus afford that? Certainly the United Kingdom, my own country, can't afford that. We have to make this better. So what's the EU approach? Well, we aim for universal coverage, protection of all workers in all workplaces and all risks. I have to say this is aspirational. We are not covering everybody. One particular group, for example, is domestic servants. They are excluded, but we need to be protecting all our workers. We also have to have flexible legislation, and this is something that has been changing over the last 20-30 years. What I mean by that is moving from prescriptive to goal-setting legislation. I'll come back to say a bit more about that shortly. The EU uses legal instruments to establish common minimum standards across the 28 member states. These are in the form of directives, and when a directive has to be transposed into national law, if the state does not do that, then the state can be sanctioned by the European Union. And the workplace protection legislation is supported by other directives, in particular ones which are termed trade directives, and this is about the safe supply of equipment into the workplace. It's no good having wonderful protection in the workplace if you are buying machinery without safeguards. And finally, there are other directives that may impact on health and safety at work. There are, for example, what are termed the Seveso directives. These are about major hazard sites, big chemical plants, and how you protect people from problems in these places. I mentioned goal setting versus prescriptive legislation. This is a significant change. Many years ago, I was a labour inspector in the United Kingdom, and I had something called the Factories Act. And I would go there, and it was a book about that thick, and if it was in the law, I could do something about it. If it was not in the code, I could not. And it had to take place in what was legally defined as a factory. And if the work was just outside that, I had to walk away, there was no legal coverage. This is the old-fashioned prescriptive legislation. It will say, you must have X, Y, and Z. The trouble with this is inflexible. We've said that society and technologies and the world of work is changing, so the legislation has to be flexible to meet these changes. So the goal-setting legislation which we have identifies a general goal and puts in a structure that allows different interpretations of the situation and finding the best solution. This has its own problems. You need to have people who are competent, and it can be hard to assess what is whether there is compliance of the law in the workplace. But this is a clear development we are seeing in health and safety. Just to illustrate this, this is from our latest survey, which we carry out in Europe's workplaces. And we asked last year, what are the biggest risk factors in your workplace? Sorry, the text is probably quite small here. We asked, what are the biggest risk factors in your workplace? And the number one answer we got back was having to deal with difficult customers, patients, pupils, etc. Now, we've just heard from representation of teachers, and yeah, if you ask teachers nowadays, and you survey Europe's teachers, they are leaving the profession in vast numbers. Why? Because of the stress and even the threats and risks of violence that they are suffering in Europe's schools. But it's not just teachers, nurses, social workers, even staff in fast food restaurants. Many people are being threatened with violence, suffering violence, and put under very great stress from this interaction with third parties. Yet there's actually no specific legislation in most member states and at European level that actually addresses this problem. It's now seen as almost like a new risk, although it's always been there. What I put on here, going down the list of risk factors, at the top we have dealing with difficult customers. Then we have tiring or painful positions. This is MSDs, musculoskeletal disorders. Repetitive hand or arm movements, again ergonomics. Then we get down to the traditional risks, machines, lifting and moving people with heavy loads, accidents with vehicles. Time pressure then comes in, work to short deadlines, chemical substances, slips and trips, hot and cold, loud noise, and then we're down to some other minor issues. But you can see for a lot of those listed risk factors, the ones with the little pink arrow are the ones where we can see there's a specific law about that at the moment. So many of our modern risk factors are not directly covered. So what we have in the European Union is this structure, and we have what's called the Framework Directive 89391 EEC, and basically says all hazards and risks should be addressed, covering workplaces, workers and employers as far as possible. It provides a common structure which says you have to do what's termed a risk assessment and then conform with a hierarchy of prevention, so general steps of prevention. This is in all member states, and this general directive is supported by some more specific directives addressing work group, specific working groups, certain issues on the work environment, work equipment. And in this directive, the employer has the primary duty. The employer is responsible. The employer can delegate tasks, but he cannot delegate responsibility. As President Truman of the United States used to say, the buck stops there. They stop with the employer. Yes, the workers have certain responsibilities and duties, but the primary one is on the employer. I've looked at about 25 related directives under the framework directives, covering everything from noise, vibration, pregnant workers, but I'm not going to go through these. But these directives follow the same structure as the framework directive. So what the employer is asked to do, very simply, he has to, where possible, get rid of a danger. If that's not possible, then he has to assess the risks and take action. He has to inform and involve the workers in this process, and he has to collaborate with the other employers so they can meet their legal obligations. He has to involve the workers, because it is the workers who know where the dangers are, and it will be the workers who have to act with the preventive measures. It's no good putting in place a solution that doesn't work, and it will be the workers who know about this. And having to collaborate means that where you have shared workplaces, or you have what is common now, you will have one workplace where you may have cleaning services provided by one employer, security services by another employer, and then there may be other contractors on site. There is a requirement to collaborate, share information, and make sure everyone is protected. We talk about risk assessment. All that is a systematic approach to identifying and controlling hazards. Saying, what are the problems, what are the dangers, what can we do about these, and then putting in place measures to reduce the risk to an acceptable level. That's all risk assessment is. We could talk long about it and how it can be done well and things like this, but this is another talk. But this is the legal requirement in the European Union to do a risk assessment in the workplace. And we actually asked in our last survey, do you do risk assessments? And across the EU, 3/4 of businesses said they do a risk assessment regularly, because you have to change when the workplace changes. And 90% said it's actually a useful process. 90% of European Union establishments, workplaces, said they had a safety document which said what they do about health and safety. But there are a great amount of variation within that overall numbers. Just for comparison, in Cyprus, about 50% of the enterprises said they were doing risk assessments, and of those, about half of them said they did it in-house, and 25% said in-house, and the rest, it was done by an external contractor. When I talk about the hierarchy of prevention, what I mean is that there are these broad steps that the employer must take. Avoid the risks with risk assessment, address the risks at source, substitute the dangerous for the less dangerous, and prioritise collective measures over individual measures. This last one is very important. If, for example, you have a noisy workplace, just giving ear protection is not complying with directives. You have to try and reduce the noise first. And if then the noise is still too loud and you have no other options, then you are giving ear protection. The reason for this is that usually personal protective equipment gives far less protection than it actually will say on the packet. And as I said, the employer has to have a coherent prevention policy, give the instructions to the workers. He has to adapt the work to the individual and not the other way around. So it's no good giving one piece of work equipment to all workers, because if you have older workers, younger workers, big people, small people, they have different needs. It has to be the work adapted to the worker, not the other way around. And we have to adapt to technical change. We have to say, well, these machines were what we had to use. Now we have new machines with better safeguarding, with better processes. You have to keep up to date. So we say law, health and safety law is absolutely essential, but it's not the only thing we must have in a health and safety system. We have to have a situation where employers and workers know about the dangers and the solutions that exist. We have to have a clear inspection and compliance structure. There's no point having a law if you have no one to enforce it. We have to have technical support and health and safety capacity in the country. There's no point having a directive on noise, or a law on noise that says you have a limit value of 87 decibels if you've got no one who can measure it. You have to have the technical support and capacity. And finally, you have to be taking a strategic approach, talking to all the actors and having, in effect, a plan of how we make things better. Why we say legislation is important? Well, in our survey, we asked the employers, we asked them the workplaces, why do you protect your workers? Why do you do health and safety? And the answer that comes back clearly and consistently, because there's a law that says I have to. You have to have that legal base to have effective health and safety. But why we say law alone is not enough, we also turned the question around and went and said to the people who said, no, we're not doing anything. Why are you not taking action? And basically the answer came back is, we've got no problems. And the smaller the business, the more this enters. What we see here now is what we can term an awareness gap, because we actually see in statistics that the small businesses are the ones which have the problem. Because they're small, they don't have the resources, the money, the knowledge to take action. There is an awareness gap, so we have to be getting information about the dangers and about the solutions to these small businesses. Finally, just briefly to mention, we have at the moment in the European Union a strategic framework that identifies the three big challenges that we face. The first of which is about implementation. How we have a problem in implementing protection in all the workplaces of the EU, and in particular the micro and small businesses. We see work-related diseases are a major problem, not just diseases that will kill you, like mesothelioma arising from exposure to asbestos, but also the health problems that force you out of work, the musculoskeletal disorders, things like back pain, the workplace stress that cause mental health problems. These are costing you massively. And finally, we see the changing, aging working population and the need to keep older workers in work and productive. So what the European Union wants to do is to make sure that each country has a national strategy, to make sure that member states are ensuring that micro-enterprises are complying with the law, to try and see if legislation can be made more simple, so it is more understandable, to address the new problems we're facing, like aging and occupational diseases, to get better data collection. This is a common problem. We don't have good enough statistics, and to try and have international coordination improved. I will finish here. These are two more images of Bilbao. It's usually sunny, but not as much as here. So thank you very much for your attention, and I'm at your disposal for any questions.